안녕하십니까. 온라인 서저리.
Greetings, I am Dr. Kim Young-won from Online Surgery. Today, I'm going to talk about surgery with you. The patient of the day, 77-year-old male patient, and the patient received a lot of implant surgery from other private clinics, and now you can see that the periodontal condition is not very good. The patient had heart condition and was taking thrombolytic agent, and in the lower right quadrant there was a lot of mobility in teeth. In the past, number 3 to number 7, there was long bridge. Periodontal condition was very bad and the patient was just taking aspirin as thrombolytic agent, but without discontinuing aspirin, extraction was done. Chief complaint was this area. Extraction was done. In the upper right quadrant, you can see that the condition is very bad. Around the lower anterior implant, there's a lot of periodontal loss and it needs to be removed later, but first I did extraction in the lower right quadrant first, which was the patient's chief complaint. As mentioned earlier, the patient was taking aspirin as a thrombolytic agent, but the patient continued to take the pills and extraction was done. After 1 month after extraction, CT was taken. If you look over here, in number 3, a lot of alveolar bone is missing and GBR is anticipated to be necessary. And in number 6 and number 7, there were rather good amount of alveolar bone. On the canine, I'm going to use the OssBuilder for GBR. That was the plan. In my opinion, in the lower anterior, the state of implant is not very good, so later I would have to remove it and do implantation later. But for now, I'm going to have some space with the defect and do canine first. And number 4, I'm going to do pontic in number 5 and 6. So slightly distal to number 6 and mesial to number 7. I'm going to try to avoid bone defect and 3 implants will be placed and relation with the antagonist will be considered. On the canine, I'm going to do bone graft and OssBuilder is going to be used for GBR. This is post-op X-ray panoramic image, and as mentioned, on the canine, implant was placed and GBR was done and 2 implants were placed in number 5 and 6. If you look at CT post-op, after implant placement on canine using OssBuilder, GBR was done, and you can see that here. And as shown, number 5 and number 6 implants were placed. Let's take a look at the surgery. Are you in pain? Don't swallow. Try to bite on your molars. Say ah. Don't move. As you can see on the labial side, there's a bone defect. Following the cortical bone height on the lingual side, TS3BA 4.0 by 10 mm implant. In the case of hydrophilic implant, irrigate ahead before placement. Using hand wrench, I'm trying to find the final position. On the labial side, thread is exposed. Number 45. Because alveolar bone is thin, we're going to slightly tilt the lance drill to find the position. Path is slightly altered vertically. Don't swallow. Close slightly. 세야. Are you in pain? Bone quality is quite hard, so 5.0 by 8.5 drill is used. It's not full length, but approximately 70% drilling is done, and after that, I'm going to place 4.5 fixture. Number 7, even if you don't place it, consider the relation with antagonist, and it is placed slightly distal to number 6. 4.5 by 8.5 millimeter drill. The bone was quite hard, so 5.0 by 8.5 taper drill is going to be used full length, and then placement is going to be done. On the back, you can see the alveolar ridge crest is being trimmed using chisel. The alveolar ridge crest on the lingual side, it's unfavorable for prosthetic process, so I'm trimming it a little bit. Remain still. The autogenous bone earlier is now being placed around the fixture. Bone graft is being done. First, allogenic bone is used around the fixture so that bone formation is encouraged. Allogenic bone first, and for space maintenance. On top of it, bovine bone EOS is used. In other words, a xenograft is used in a layered bone graft manner. 。   。 As you can see, OssBuilder, I'm going to trim a little bit because it interferes with the tooth in the front. OssBuilder cover cap is going to be used and fixed. All done. Suture is going to be done. 80.
그냥 다 커버를 하시는 거잖아요. 잘 되세요. 78입니다.
Periosteal releasing incision is done. The area where augmentation was done with OssBuilder, tension-free suture is going to be done. This is where the mental nerve is, so you need to pay extra attention. Surgery is now complete. As you can see on the canine, I used OssBuilder to do GBR and did augmentation. Surgery is now complete. Thank you.
감사합니다.